Imagine a world where every adult can seamlessly transition from hospital to home, empowered and supported by the very services designed to keep them healthy and independent. Today, we're not just going to imagine that world, we're going to have a conversation and a discussion how to make that a reality. I'm going to start with a provocative question. What if I said to you that knowing every detail of national policy, or perhaps trying to dazzle you with how to shape it, might not actually give you that result? And while that statement might catch you a little bit off guard, bear with me, because the answer and the solution is something far more exciting, important, and attainable. Good morning, everybody. I'm Jenny Keane. Most of you will know me, or some of you might know me, as the director in the National NHS England team with responsibility for urgent and emergency care delivery, which really means getting things done, getting patients moved through our system, whether that's ambulance, whether that's ED or hospitals, and also community and mental health settings. However, I think most of you may know me as in my previous roles, either as the National Director for Rehabilitation and Intermediate Care, and the work that a lot of people in this room have supported in terms of championing the intermediate care work nationally and the community rehabilitation and putting that on the agenda right at the top of the office. And I do notice one or two individuals that I knew and worked really well with when I was the Chief AHP Officer in Northern Ireland. I have to say at this point I'm a radiographer, but I'm a really strong advocate of all AHPs, and I always wear that as a badge of honour on my shoulder. But this morning, I'm going to talk about something that I think we all grapple with: national policy. But more than that, I'm here to talk about how you, as physiotherapists, can lead the charge in making national policy work for us all, our patients, and our communities. This isn't really about understanding policy, it's about leveraging it for real, meaningful change. So let's think, what is policy really? What actually is it? So at its core, policy provides us with a framework. It's a set of principles designed to guide decisions and achieve specific outcomes. Policies evolve to reflect shifting priorities: prevention, care closer to home, digital transformation, and improved access. But here's the kicker, and I think most of you know this one. It doesn't automatically translate into commissioning intent. And I've lost my space. What it really doesn't do is it doesn't give us specific answers of the who, where, or how. But that's where you come in. Physiotherapy is about promoting, maintaining, and restoring health through physical intervention, patient education, and disease prevention. So you are the ones who know how to implement these goals in real-world setting. So the question really shouldn't be, how do we navigate policy? It's how do we use policy as the tool to drive outcomes? Navigating policy is an extremely dynamic landscape. Policies change. They change often. We have all seen countless variations over the years, and some of us have seen the same ones recirculated back round again. Conversation on that at breakfast just this morning. There are policies on prevention, shifting care into the community, improving access. We've heard them. But when it comes to care transitions, or particularly rehabilitation, you might feel often a lack of direct acknowledgement. And that's frustrating. Yeah, that is frustrating. but I want to offer a slightly different perspective on that. The core of what you do as physiotherapists doesn't change, regardless of the shifting policy landscape. Our job, your job, my job as a national leader, is to be nimble, to align that expertise, your USP, with the policy objectives of the day. It's about the optics and the language we use. So when a new policy promotes care closer to home, that's a golden opportunity for you to step in and say, yeah, that is what we excel at. We're already experts in helping older people maintain independence at home. This is the policy that is for us. So why have I focused on talking about older people and care transitions? So I could quote you statistics, most of you will know them better than me, regarding an ageing population, increasing demand on healthcare resources. But at the end of the day, here's my simple truth. If we get it right for older people, we pretty much get it right for everyone. Older people make up a significant percentage of those requiring healthcare interventions, and if we can improve their care transitions, you can make the entire system more efficient and compassionate. Care transitions are where things fall apart. Whether it's a patient moving from hospital to home, or somewhere along the way as they move from one team to another, the handoffs go wrong. Lack of coordination, incomplete digital records, siloed working, these are the gaps that cause patients to fall through. And when one thing goes wrong, it goes very wrong. So I don't think we necessarily need more policy. What we need is better implementation of existing policy, and that's where I think you come in. So let's make this real and completely bang up to date. And let's talk about the most recent and probably the most seminal piece of policy intent that we've got, which is the Darcy report from the Secretary of State. So let's consider it, and let's consider the intent that it's giving us on how that report is now going to shape future policy. So the Lord Darcy review lay out a clear vision for the future of healthcare, and it's one that emphasised prevention, integration and care delivered close to home. Ideas that really deeply resonate with you as a profession. The Darcy report in particular offers several crucial insights. While it broadly addresses the challenges facing the NHS, it does recognise the importance of rehabilitation and care transition. So let me break down how, as a national policy leader, I see what's in the Darcy report as being key to you as a profession, but particularly in relation to rehabilitation. First key theme is an integrated approach. The report highlights the need for an integrated health and social care system, silos no longer working, and it's this very independence between service that makes effective care transitions possible. As physiotherapists, you are the experts in bridging those gaps. Shifting focus to the community. Darcy advocated for a rebalancing of funding from hospitals to community services. This shift directly supports improved rehabilitation and care transitions, emphasising that the future of healthcare must work hand in hand with emphasising that the future of healthcare isn't just about acute settings, but on people's own homes and communities, your domain. I'm standing on this stage this morning as the National Director for Urgent and Emergency Care, which people think means hospitals. But I know in my role that the only thing that will make a hospital work is the community services that wrap around it before and after an admission. Social care as a critical partner was the next of the key themes. And it emphasised the vital role of a strong social care system in keeping people healthy, independent and out of hospital. For care transitions to succeed, rehabilitation must work hand in hand with social care to ensure patients move seamlessly from hospital to home and from home to hospital. And therapists are uniquely positioned to lead on that. Person-centred care. Again, it emphasised the importance of enabling people of all ages to live independently and manage long-term conditions, the very essence of what you do in rehabilitation, helping people regain function and autonomy. Finally, the last key enabler that I see is digital innovation. It calls for embracing it, whether through tele-rehabilitation or digital care planning tools. Technology offers us new ways to support people at home and in the community. So if you couple the Darcy report with the Secretary of State's commentary on the state of the NHS, which frankly acknowledge the immense pressure on our services, a clear picture emerges. The future lies in upstream prevention, community-based care, and reducing the burden on hospital. It can be read as a call for physiotherapists to step into leadership roles and guide those transitions. So it's a very dynamic landscape, but with that policy intent in mind, we face a really important question. How do we all navigate it? The challenge is how you present and articulate what you do. When policymakers talk about prevention and care closer to home, they're talking about the things that you excel at, and that's where your expertise comes in. So the question really isn't, how do we navigate policy? How do we use this policy as a tool for real outcomes? So one of the biggest hurdles we face when ensuring that the impact of physiotherapy or rehabilitation is understood across the wider health and social care landscape and getting that understanding. So how can we address that? Well, I'm not an academic, I'm not an expert in that, but what I can say this morning is 5 things which I think are the things which you can do, because they're the things that worked for me in being able to land, for example, why we needed an intermediate care framework, why community rehabilitation was the answer to long-term social care delays. The first of those is speak their language. Articulate your work in terms that resonate with policymakers and commissioners. Link your outcomes to key policy objectives like reducing hospital admissions or improving community care. Quantify your impact, not your outcomes, your impact. Use data to demonstrate cost effectiveness and patient outcomes. For example, show how services reduce length of stay and prevent admissions. Collaborate across boundaries. Showcase how physiotherapy work effectively across different care settings. Embody the integrated care approach. Engage in policy discussions. Be proactive in contributing to policy consultations and discussions, because it's your on-ground experience is invaluable in shaping realistic and effective policies. I have to say, as somebody who sits in a national role, CSP is probably one of the professional bodies that excels at this, absolutely excels at it, and the recent Labour Conference is a perfect example. Then educate and advocate. Take every opportunity to educate colleagues, policymakers, the public, about the breadth and depth of what you do. So I think one of my final messages, key messages are, you are the implementers and you are the change makers. You're not just following policy, you're driving it forward. As an organisation and as a profession, you are extremely politically astute. You know how to communicate the value of what you do in a way that makes you indispensable to policymakers, commissioners and leaders. No other profession has a member of their profession sitting on national boards. You do. Make the most of it. Let me remind you as well of something that I think is quite an important reflection. And that is, as a professional group, you've sustained your purpose across multiple policy shifts. And you've done so largely because your work is vital to patients. So what we need to do, you and I, is better articulate that in a way that resonates even further and wider across the system. So as I stand here today, I don't think I'm looking out at a room of physiotherapists. What I'm looking at is a room full of change makers, innovators, and leaders. You're the architects of the healthcare system that truly puts people first. Your hands don't just heal bodies, they build the bridges between policy and patients, between hospitals and home. Remember that every time you help a patient take their first steps after surgery, you're not just aiding their recovery, you're taking strides to more and more integrated, efficient healthcare system. Every time you teach an older adult how to maintain their balance, you're not just preventing a fall, you're upholding the dignity and independence that every person deserves. The future of healthcare isn't just in the halls of Parliament or in the boardrooms of NHS England. It's in your clinics, it's in community centres, and in the homes of those you serve. It is your expertise, your compassion, and your unwavering commitment to your patients. So I challenge you, be bold, be innovative, be the voice that turns policy into practice and turns your practice into policy. Because when physiotherapists lead, patients thrive, communities flourish, and our entire healthcare system takes a giant leap forward. The power to transform healthcare is quite literally in your hands. So let's get out there and shape a future where every transition is smooth, every policy serves its purpose, and every person ages with dignity and vitality. The time is now. You're the ones to do it. You've literally got a blueprint from the Secretary of State that could read as your policy strategy. Thank you.